We have to start. Good morning, good afternoon to all of you that are connected. This session, this is the sixth session of our course. This session is basically on the means that different countries foresee for providing technical assistance to the companies on occupational safety and health. Also, it will include topics regarding on information, how to provide information, or different experiences on how to provide information, and the provision of training on occupational safety and health for those that need to know on occupational safety and health. For this session, we have with us Ms. Ana Catalina Ramirez. She works in the ILO Geneva in the Department of Occupational Safety and Health. And among other things, she has been in charge of activities and projects related with information, training, dissemination of occupational safety and health information, such as, for example, the World Congress on Occupational Safety and Health that took place last November in Australia, in Sydney, Australia. So the rest of the session will be delivered also by me. So Ana Catalina will start with her presentation on these topics. Thanks, Ana Catalina, for being with us in this session.
Thank you, Felix, and good morning to all the participants. It's a pleasure to be with you in the course to speak about what are the means to offer technical support and services on occupational safety and health to enterprises. I will share the presentation. Yes, that you think you are, I think you are already watching the presentation.
Yeah.
So thank you. So basically, just to start saying that technical support and services to enterprises is key really to be able to comply with national legislation and other international standards, where these are private compliance initiatives, or these are requirements in terms of auditing at the enterprise level. These services are meant to guide employers on their duties to ensure a safe and healthy working environment, but also serve for advising workers on their different rights and also the responsibilities in terms of occupational safety and health at the workplace. As a normative framework, I would like to highlight the references that three conventions, specifically two of them fundamental conventions, made to these type of services, and also what are the main principles that the conventions bring on the table when we talk about setting up this type of services. So the Fundamental Convention 155 on Occupational Safety and Health lays the foundation of the occupational safety and health policy, national policy to be developed. I think you have already gone through that. And this is very important because within this policy, at the national level, very often we find this figure of occupational safety and health services or advisory services to enterprises. And they become part of essential part of the action program that implements the policy. Another important principle that this convention brings on board is the establishment of the different duties, rights, and responsibilities, in which it gives, of course, to the employers the duty of ensuring that all the working environment is safe and healthy for workers, that all the different elements physical and both also organizational elements are free from harm, or at least that control measures are put in place to reduce or to protect workers of any harm. It also gives workers there is the right to participate, and in certain way the responsibility to cooperate with the employer in implementing OSH measures. So here we have already the establishment of, let's say, those that have to put in place the measures, the employers, and also what is the role of workers in that, which is basically cooperate. Then we have the other fundamental convention, which is the Convention 187 on the promotional framework for occupational safety and health. This convention, as you may know already, requires that member states establish an occupational occupational safety and health national system. And this national system, which is basically the infrastructure that will support the implementation of the policy and the national program, has among the different elements, as per the convention, the occupational health services, which are considered really an essential element when we talk about implementing the certain aspects of a national program. So this figure of occupational health services actually was clearly defined by a previous convention that is not fundamental, but is very important when we talk about the implementation of the fundamental conventions, which is the Convention 161, and its accompanying recommendation. This convention will outline basic principles and the characteristics of occupational health services. The convention will define what the services are, what are the roles, and also what are the different roles that workers and employers have when we talk about setting up these services at the enterprise level. But this is not enough. We need to read all the different elements that can put into practice occupational safety and health by considering what Convention 187 on the national framework tells us. As I said, it says the infrastructure. And by setting the infrastructure, it brings together many different actors, institutions, and regulations that support and can support employers in fulfilling their duties, and also workers in cooperating and participating. So what I want to do for this presentation is basically to divide it into, first of all, by thinking first on the workplace level and what are the different occupational health services that can be present at the workplace level. And a second part where we will see also at the national level what other institutions or actors can provide advisory services to enterprises. So let's start with actually the enterprise level by focusing on really what are these occupational health services about. So the occupational health services, as defined by the Convention 161, are services that are mainly preventative services. So their main role is essentially to prevent. So they have preventive functions and are responsible for advising the employer, but also the workers and the representative at the enterprise level. On what? Well, basically on what are the requirements for establishing and maintaining a safe and healthy working environment that will facilitate really the health of worker in relation to work. And second, on the adaptation of work to the capabilities of the worker, considering both physical and mental aspects of health. So the occupational health services are basically a preventive services, and this is what we have to keep in mind. No, they advise the employer on what are the requirements for ensuring the safe and healthy and working environment, but also advise workers. So they are not, I would say, they have responsibilities in terms of, let's say, supporting the employer and the workers in installing the different measures, putting in place the measures necessary for a health, safety and health environment, but it doesn't change the responsibility, the duty of the employer of being the main responsible. They are there to facilitate the employer's duty to comply with the national regulation on occupational safety and health. And this is also very important. And we'll see that there are certain principles that are needed for that. So what are the functions of these services? So the convention established 11 functions. I won't go into detail because you can read the convention, but I would try to pack them in 4 areas. Well, first of all, they are there to protect workers' health through the surveillance of the working environment, but also of the workers' health. So they have duties and functions related with surveillance of the working environment, surveillance of workers' health, but also supporting carrying out the risk assessment at the workplace level. They also have the function of advising on measures to ensure that the working environment is safe and healthy. So basically putting in place the different control measures, the necessary control measures to control the risks assessed. They also have the function of promoting the adaptation of work and the working environment to the capabilities of the worker, not only by giving advice on how to do it, but also by participating in rehabilitation of workers when we talk about return to work, for example, after any injury or disease. And finally, they are also in charge of organizing first aid and emergency treatment. The recommendation 171 that accompanies the convention includes other functions that, well, by being a recommendation are just recommended, are not binding, but that also provide these services with functions related to curative service and the cooperation and coordination with health authorities in terms of health promotion and other issues such as, for example, immunization at the workplace. How the occupational health services are organized. So the convention gives flexibility, I would say, on how to organize the services. And if we look at what is going on at the country level, it's interesting because we see that this flexibility is reflected at the national cases. So the convention calls for establishing the different occupational health services through provisions that could be made through the law or regulations, by collective bargaining agreements, or any other manner that would be approved by the competent authority, of course, after consultation with representatives of workers and employers. What we have seen in the practice, or we are seeing the practice, is that mostly those services are established through law, through national regulation, sometimes specific law, sometimes in the occupational safety and health law or legislation. And these legislation specify aspects such as how these services have to be organized, what type of professionals have to have, and what are the requirements of such professionals to do their work. Also in terms of financing and in terms of evaluation and ensuring quality of services. So these are some of the main topics that normally regulations cover when we talk about occupational health services. It's also possible and I would say frequent to find collective bargaining agreements on this, especially when we talk about occupational health services that are in-house, and we will see that. And mostly in these cases, we also will find that other functions are given to these services, such as more curative and health promotion functions. The services can be organized whether for a single enterprise or multiple enterprises, and this we will see that it can change depending on I would say the national legislation, but also the size of the enterprise. So mostly in the practice, in the countries that have established this type of services, we see that, I mean, when the enterprise is what we consider a big enterprise, there is the provision for having in-house services. But when we talk about medium, small enterprises, some countries have already provide for multiple enterprises to be service, to have the service of one structure. So these services can be organized also by the enterprise itself or by a group of enterprises. They can be organized by the public authorities or official services on occupational safety and health. Sometimes by social security institutions, meaning that the social security institutions organize the service and the delivery of these services, and any other body that is authorized by the competent authority, for example, sometimes OSH institutes, or a combination of the above, which is something that we find often as well, meaning that whether you have a small and medium enterprise and you are served by, for example, the public authority or the social security institution, or you are a bigger company and therefore you organize your own service in-house, depending on what the legislation establishes and provides for. It is important to also to highlight that the financing of these services is strongly linked with the way of organizing. And as the Convention 155 gives the employer the duty of ensuring that we are that the work is safe and healthy for all workers, most of the time is the employer the main mechanism or who has the responsibility of financing the services. This financing can be done through different mechanisms, whether a direct organization of the service, for example, when it's in-house, whether through contributions to public funding such as Social Security, or in other cases, employment injury schemes that also provide these services for the enterprises. And finally, during this organization of the service of the occupational health services, cooperation and participation of employers and workers and the representative, if existed, is foreseen by the convention when we talk about implementation of organizational and other measures. So it is expected that the way that these services are organized includes the cooperation and the participation of both employers and workers. What are the conditions of operation of these services? And this is where the convention actually gives us some principles for the well functioning of these services. So one of them, the first condition is the need of having multidisciplinarity. As occupational safety and health is really a discipline that integrates different disciplines, no? We have a hygiene, but we also have organizational psychology, we have occupational medicine, we have ergonomics, we have so many different disciplines. The idea is that the multidisciplinarity of the services reflects the complexity of occupational health services. Of course, the convention considers that this multidisciplinarity has to be in relation with the complexity of the workplace, meaning that it's not the same what I would need if I'm talking about the mining sector that if I'm talking about the banking sector, for example. So the type of expertise that is required by a sector can vary, and therefore the disciplines that need to be considered will vary. And this is very important because most of the time when we talk about occupational health services, the first image that comes into our mind is the occupational physician, is the doctor that is in the enterprise. And actually, it's more than that. It's all the other professionals that have to cooperate and coordinate to really provide support to control all the different elements of the working environment. Another condition that it's a principle itself is the full professional independence that the different professionals in the service have to have vis-a-vis the employer, but also vis-a-vis the workers. So these professionals also have to receive or to be informed about any suspected factor that may affect workers' health, and also about any ill health occurrence in the workplace. And it's very important that they don't have to inform, this is what it's in the convention, the employer about any cause of ill health. So this is a way of safeguarding the independence, and at the same time saying that they need to be informed and receive information in order to be capable to do the job. Another condition of operation is that any health surveillance activity have to be free of charge for the workers, and have to occur during working hours in a way that this is not going to affect the workers' income, let's say, the workers' total reward during the working hours. The cooperation, it's essential between the occupational health services, but also other services in the enterprise. For example, the human resource, the service, the environmental service, or the service related with the production, for example. So it's necessary that these services cooperate and coordinate with those other internal services. But also at the national level, it is also expected that these services will coordinate or cooperate with other health services, for example, the national health system and the different institutions of the occupational health system itself. And finally, in terms of information, not only the occupational health services have to receive or be informed of the different factors that may create or represent a risk for the workers' health, but also workers shall be informed of any relevant work-related hazards by these by the occupational health service, and this is very important. So these are some of the conditions of operation of these services as established by the convention. So as you can see, the convention gives, I would say, different options for establishing this service as per the national practice, but also the national legislation and the national health systems as well, and the national occupational safety and health system. What is important is at the end that the organization and the financing allows for the conditions of operation to exist. That doesn't contradict, let's say, what are these conditions. For example, the independence that professionals need to have, or ensuring or promoting that multidisciplinary exists. Most of what we are seeing in the practice is that enterprises, whether they have their own services and hire their own professionals, but more and more also we see that there is an outsourcing of these services, meaning that they have contractual arrangement with private services that provide these on demand. It has benefits, of course. One of the benefits is that it creates, I would say, a new market for occupational health services, impacting in the price, so lowering the price so more enterprises can have access, but it also have cons. One of the main constraints is the fact that not being in place or not being so familiar with the industry, the assessment of the working environment and also the health surveillance of workers, well, it's affected. It's not the same as if the professional is inside and knows I would say, the day-to-day of the worker, and therefore can provide better also recommendations when we talk about workers, work adaptation to workers' capacities. One of the main challenges for establishing occupational health services is that actually not an important number of the working population is covered. It is estimated that globally, only 20% of all the workforce is really covered by these services. And if we see the concentration of these services, they are mainly in developed countries, economies with that have, I would say, a more industrialized tradition. Most of the workers that are in the small, medium enterprises or in the informal economy, which are the majority of workers in many regions, do not benefit from these services. So the ILO and the WHO Joint Committee on Occupational Safety and Health worked in putting together a concept which is the basic occupational health services. That it's a concept that actually try to provide increased service by increasing the number of functions that are required at the workplace level. It's important because the convention actually gives this flexibility to the member states. It says that the member states can develop a policy that will increase the coverage in the time by specifying what sectors or workers are not immediately covered, but also by saying how they are planning to cover those sectors that are not covered by the policy immediately. So how they're going to scale up the coverage. So this model has been applied in several countries, especially in the Asia region. And what basically it tries to do is to create a very first level, which it will only integrate the advice in terms of occupational health, the prevention of accidents and occupational diseases, and I would say supporting the notification of these accidents, that will deal with only acute ill health, and will have some activities related to primary health. Normally, this type of services require, which is the stage one that you can see on the slide, require less professionals or less diversity of professionals, and can be run out by a field nurse or a safety agent, not necessarily a professional specialized on occupational safety and health. What we have been seeing in the practice is that in order to set up this very basic stage, together with the stage two, countries have partnered with the national health system to include these contents into the basic health services. So in the primary health care, so that more workers, self-employers, or also workers in the small and medium enterprises or in the informal economy could benefit from that when they go through the different basic healthcare service, the primary healthcare. So the idea is that the basic service will give basic content on prevention, will give some tools, will help to deal with consequences and prevention of accidents, and do not necessarily will integrate other aspects such as curative services or surveillance of the working environment by the service itself or the health surveillance, but it's going to be really about supporting preventative measures and supporting acute health when it happens and accidents and disease. As I said, this model has been applied in certain countries with good feedback in the sense that it allows to increase the coverage of working population that can benefit from occupational health services. And considering that we only have 20% of the working population that really has access to the service, it's a good alternative for many countries to consider, especially because it helps to deal with those sections or with those sections of working population or sectors where financing of these services is difficult, but also where countries in where we don't have enough professionals to set up occupational health services in all the working places. So what happened at the national level? And this is linked with the fact that we have many types of enterprise, a small, medium, micro enterprise that don't have necessary access to occupational health services. We have informal economy workers. I mean, that we have population that do not benefit from this. More and more, we also have self-employees. I mean, certain categories of workers that do not benefit from, I would say, a traditional model where you have in-house services to advise on occupational safety and health. Where this is where also the national system becomes really interesting and very helpful. Thinking about the different structures of the system that can support actually these type of employers, and also why not big employers, to by providing technical advice. So we have certain elements of the national system that play that role, play an advisory role, sometimes training, sometimes also providing tools for employers to conduct their own assessment and taking the necessary measures. Those elements are, for example, the training and education institutions in general, specifically on OSH, all the research institutions that do research on occupational safety and health, whether it's at the university level, whether it's at the institute level, or at the, I would say, public and private level. The enforcement bodies that also provide advisory service, such as the labor inspection, the social protection schemes, basically employment injury insurances, but also social security systems, as already mentioned, and the National OSH Institutes. All of them can provide advisory services to enterprises, not only to the employer, but also to the workers on occupational safety and health. So what type of support? So in 2019, we look at that. We did a review of the international practice on what type of services are out there for employers, basically, for employers' organization. And we found, I think, very interesting offer. For example, a guidance for supporting compliance, supporting what they have to do. We saw this very often during the COVID pandemic. So guidance that were put out there, especially digitally, for employers to fulfill with the requirements of the COVID-related standards, but also on guidance on how to work from home. So here you have, for example, the health and safety executive from UK guidance, but also from the Irish Department of Health and Safety, the authority, that they issue this type of guidance for different employers. We also found that there are many other institutes or authorities that provide tools that are basically web-based for conducting a risk assessment. So this important function that occupational health services play. So in case that there is not this service in place, we're talking about, for example, small, medium enterprises, we have many already sites that provide that, whether it's an authority like the one we see here, the BSmart, that is from the Irish authority, or those that are, in this case, from EOSHA, the European Agency for Safety and Health, that produce this OIRA, which is an interactive risk assessment tool, especially for small and medium enterprises, which guide the enterprise, to do all the steps of the risk assessment and complete the assessment. We also found that there are many other offers from these different elements of the system in terms of training through not only physical training, but also digital training through applications. So we have here examples of what NIOSH in the United States do by for example, the heat safety tool app that support employers to monitor temperature in the workplace, but also many videos that EOSHA has produced on specific topics that are quite friendly, animated to support specific control measures depending on the type of risk. And finally, we also found very interesting that there are many other institutions that are collaborating to support companies to collect data on accidents and diseases. So not only to notify these accidents, but also to have a system to monitor the accident. So here is an example of the government of Bangladesh, the labor inspection management application that supports the notification of accidents for the enterprises in a way that they can do it inside and online. So these are some of the examples that we found, and as you see, are from other elements of the national system. And finally, in terms of education that I already mentioned, we have the integration of occupational safety and health into the educational curricula, which is, of course, providing already, I would say, a base for employers, but also for workers to have basic competencies on occupational safety and health for workers. And of these also, we have many examples of different type of ways of doing in many countries. Some other interesting aspects that are not necessarily linked to providing the service, but by encouraging companies to look for these services and implement or comply with their duties, are those elements that create incentives for companies. So we have two types of incentives, whether they are financial incentives, such as tax exemptions, grants of subsidies for employers or to implement certain aspects, such as completing the risk assessment and following up, or others that are linked with the insurance when we have employment injury schemes that also support employers saying, okay, we are here to support you by doing your risk assessment, by putting in place your OSH management system, and you will have a benefit if you reduce your accident or if you complete the process. And there are, of course, non-financial incentives that are also very effective, which are public awards or some changes in the frequency of inspections that some countries have adopted to encourage employers to make use of these different the offer they have in terms of advisory services. This is the publication that I was mentioning, where we study what are the different elements of the national system that support employers and how they do it. And we collected different practices. And at the end, also, what it's interesting is that employers' organizations themselves can also support companies, can provide companies with advisory services if they manage to create their own unit or service on occupational safety and health. We found very interesting examples that you can look at in this publication that it's online. So this is what I wanted to share with you today. Felix, so I don't know if we have time for questions, comments.
Of course, thank you. Thank you very much, Ana Catalina. I would like to invite the participants, if you have any comment or any question for Ana Catalina, or you want her to expand some of the issues that she has presented. Any of you? Ana Catalina was presenting different options that are foreseen in the convention 161 of how to provide the advisory service to the enterprises on occupational safety and health. It's important to know that there is a lot of different models. I mean, there is not a common model in the countries. In fact, most of the times that we have problems just because we are approached. ILO is approached, say how to organize this system for providing advisory bodies, and it's not simple because each country may have decisions on this, on how to do it. I mean, according to the capacity, according to the stage of development, according to the training possibilities, etc., etc. So it's a decisions, and to make a good decisions, it's good to know what are the different options that you can have or you can develop. So. Okay, if you don't have any question or any comment, I would like just to continue with the presentation. I will deliver my presentation that is well connected with the presentation of Ana Catalina. And I will focus more on issues related with information and training. But I will also include some references regarding advisory services. So let's share my screen on this thing. As in the previous presentations, you can find these presentations already uploaded in the platform, so you can have a look, or you can have it this PowerPoint presentation. So the first thing I always like to share, just to share in this kind of presentation, is how many people are working in one country, in this case, in Italy, on occupational safety and health. These are data of already around 8-9 years ago, But I would like just to make a point on how human resources are in the country on occupational safety and health. For example, in Italy, there are two bodies in charge of labor inspection or safety and health inspection. There is the labor inspectorate that they have 5,300 staff, and we have one inspectorate of the health ministries, regional health ministries, that there is around 1,500. So these people are mainly in charge of enforcement activities. Additionally, there are outside the companies, there is 12,000 people that are in charge of providing compensation, cure, rehabilitation services to the injured or sick workers. So there is around 12,000 people of this institution. This is a national institution in charge of compensation, cure, and rehabilitation of injured employees. There are 900 people that now has been merged to this other institution that are in charge of providing advisory services, research on occupational safety and health. And there are occupational hygienists that they are external to the companies that provide services to the enterprise. What I would like to bring to your attention is that inside the enterprises, you can find 7,500 occupational doctors. You can also find 600,000 safety and health specialists in the, 500,000 enterprise safety managers, I mean people that are hired by the employer to take care of the safety and health in the company. And also there are 600,000 people that are representatives of the workers on occupational safety and health. What I wanted to bring to your attention is that frequently when we are thinking of how to improve the safety and health of the companies, frequently it is emphasized too much the number of labor inspectors that we have or the number of other safety and health specialists at the national level. I mean, staff in the national institutions or in the external bodies, when the real important thing is to have as much as possible staff inside the enterprises with the capacity to provide occupational safety and health services. Because these people are working every day in the companies on the safety and health. So in a country like Italy that maybe has between 25 to 30 million people, if you have almost 1 million people in total in which that they can do work in the enterprises, this make the difference. This is why I always wanted to bring to your attention this fact. Frequently, we don't emphasize enough how important it is to have people well trained in the enterprise. And I bring this thing to your attention because this is one of the main difference, maybe the main difference between those countries that performed very well on occupational safety and health and those that do not perform very well on occupational safety and health. The lack of internal staff on occupational, safety and health. Let me bring to now other issue is regarding how to provide information. What are the different types of information on occupational safety and health that can be provided? One is the basic disseminations, that is just to raise awareness of the people on occupational safety and health that frequently are made in different ways, media or campaigns, the Safety and Health Day, that as you may know is 28th of April, some awarding prizes of best practices, Other way is technical dissemination. That is differently to the basic dissemination. The basic dissemination is mainly for employers and employees. Technical disseminations are for those that are safety and health specialists. And they need to know what are the latest technical advances and presenting successful experiences through conferences, publications. So this technical dissemination is also very important because it allows those that are specialists on occupational safety and health to share their knowledge and to learn more about this thing. Information. The basic information is how people may know on occupational safety and health. Some countries, they have safety and health institutes or safety and health systems that involve public and private enterprises or companies, and it's done in different ways through libraries, through internet, or occupational safety health portals, networks. This information now has, with internet, in the last 30 years, has been is something that shouldn't be a problem to have access to safety and health information, because there is a lot of information available on internet. However, this is not so simple when we have to provide information to specific needs. It means that in one single country, a company may require very specific information to do something. Frequently in some countries, for example, in some inspectorates or in some institutes, they have created a telephone or a fax or an email system for which those that need to know about regulations or technical issues on safety and health can access to that. I mean, for example, in my country, any employer or employee can make a request of information on safety and health, and our Safety and Health Institute will report 95% of the requests in less than 2 days, the most complex ones in less than 15 days. So everything that you may require in terms of information is satisfied by one institute that is created with this purpose. One quite common thing to disseminate information or to include a set of interventions is a campaign. Campaign basically involves the provision of services, including different measures with using different resources, and are implemented in a fixed period of time or with a specific sequence. I mean, and the idea is to raise awareness or to have a particular impact on a target group or on a specific hazard. Why are campaigns are good? Because in general terms, try to provide information using plain language, using also the best means for a specific target group. It also normally is connected also with the compliance with the safety and health regulations in addition to provide information to the duty holders, they also assisting them on how to comply with this regulation. In general terms, these campaigns are not also restricted to workers or employers, but also there are other groups in the civil society that may know about these campaigns and can raise awareness on future workers or in those that are linked with the world of work. And also, frequently, these campaigns are conducted by inspectorates or bodies in charge of promote compliance or ensure enforcement. And campaigns is a way in an alternative, not an alternative, a complementary way of this sanction approach for which compliance bodies visit companies, and those that do not comply with the law receive a sanction. So this way is a most, let's say, positive approach in promoting safety and health. I will bring you to the example of one campaign that was made by the European Union countries. I'm talking about for more than 20 countries that made an experience in a campaign on occupational safety and health on dangerous substances. They were at the end 27 countries, and they identify some sectors of activity. Normally, they are small businesses, because frequently big companies, they already have the capacity, the staff, the knowledge, and the experience on dealing with these dangerous substances. Small businesses, many times, are not so good on that. So they targeted 5 categories of small businesses that may have quite dangerous products or substances. One was the dry cleaning, another was the industrial cleaning, furniture, motor vehicle repair, and bakeries. These were the 5 sectors, the 5 type of companies in which was targeting this campaign. They create a mascot for this campaign. They also produce training materials, including posters, general flyers on the campaign on risk assessment, and brochures too. And they also develop a website. It was complex because we are talking about that in these 27 countries, maybe you have around 17 different languages. So you have to develop, each country develop in their own language the campaign. Some they were posters, other times they were instructions on how to conduct a risk assessment in the companies. And basically, also they develop this in the web page systems on how to self-evaluate, self-assess the situation in your company on dangerous substances, and also how you perform the preventive measures. The campaign included basically an official letter to these companies that they were identified, a flyer with the risk assessment, and an informative brochure for the sector. And for example, the labor inspectorates work in this way. I mean, basically develop a questionnaire for all the companies, asking them for information, to provide information on the dangerous substances that they have, and how they manage these dangerous substances. They identify the companies through the databases that they have the labor inspectorate. Local inspectorates receive instructions on how to perform this campaign. So all the inspectors involved in the campaign, they were trained. Questionnaires were sent to the companies, saying, look, we need you to fill these questionnaires and send the information back to the inspectorate, because we are organizing an inspection visit to these companies, to your company. So basically the idea is they have different objectives of this company. First is they have to check what are their own dangerous substances in each company. In this way, the companies were obliged to assess the risk of these dangerous substances that they have. In one way, when you are doing, or you are asking them to provide information on the dangerous substances and how they are managing these dangerous substances, you are stimulating them that to take care of the safety and health associated with these dangerous substances. This campaign also have a multiplier effect, but because all the companies, not those 5 categories of companies, also adopted the measures, because they saw that the labor inspectorates were particularly interested in the dangerous substances, they try to adopt a preventive approach. So it means that companies were expected to adopt preventive measures even before they were visited by the inspector. I mean, the instructions provided by in this campaign were linked that you have to identify your dangerous substances. You have to adopt a number of measures to be in accordance with the law. This campaign also have, I mean, inspectors visited a number of these companies, and also it was very helpful because they collect a lot of information, a lot of data on these companies, and they saw a lot of level of, I mean, the level of compliance was very relevant. So let me just show another example of from the European Union in this case, in which employers were asked what was the best forms of consultation, advice, and information on occupational safety and health from the labor inspectorate. And basically, they analyzed in the European Union what were the most effective or which type of approaches are the most effective in sharing information to ensure compliance with occupational safety and health. According to the opinion of all the inspectorates in the European Union, the best ways were the organization of seminars, conferences, and info days. This was one of the most effective ways. The other are the consultations and advice for companies during the inspection visits. These were the most effective ways. There are other ways that are also important or necessary or useful, but not as these two ones. One is the dissemination of safety and health information and materials, or online informative materials on safety and health, or distribution of printed information materials, electronic consultations, consultations by phone, oral consultations. So you can see that there are many ways in which labor inspectorates or safety and health departments can share information, but it's also important to identify in which way we can deliver information, because sometimes we think that, for example, just placing materials in our web page is good enough. But if we analyze one specific target groups, we may discover that people don't care about what is in your website. So unfortunately, I mean, it's not so simple. I mean, for example, in some analysis that have been made in some countries in Europe, they have realized that employers, managers of small businesses, they don't, frequently they are not using the documents that you can have in your web page for safety and health. So they don't read documents. So they prefer consultation, I mean, direct oral consultations with inspectors or with safety and health practitioners instead of reading material. So you have to see which is the target group and what is the best way in which you can convey the information that you want to share with this group. Regarding information, regarding education and training, we can differentiate education and training. Education basically is provided information related on safety and health for those that in general may need some concepts. The idea is mainly to create a safety and health culture rather than to provide a specific training for carry out some functions or activities on occupational safety and health. So when we are talking about education, we are talking about basic education on safety and health. And as was already anticipated by Ana Catalina, I mean, this basic education is for those that are in the schools. There are many countries that has included safety and health contents even from primary school, because we wanted that these people, these kids, can develop a safety and health culture. At this level, we are not talking about occupational safety and health. We are talking about safety and health in the school, safety and health in the streets, safety and health at home, safety and health when you are just playing, you know. So, but it's important because this education, this safety and health culture will be required later when they will become workers. And in fact, other way in which, or in other area, or in other stage, you can receive already occupational safety and health training is at the vocational training. I mean, when you are prepared to become a safety and health, to become a worker, you need safety and health training. And frequently, vocational training schools provide this safety and health training. There are two things that are relevant for when you plan and to deliver safety and health training for in the vocational school. I mean, one is that you should try to involve, or you should try to incorporate the safety and health measures and procedures when you are teaching them how to perform their duties. So one good practice that many vocational training schools has identified is as much as possible include the safety and health procedures in the working procedures. Don't use safety and health as a separate matter, as if the way in which you have to work should not incorporate safety and health issues. I mean, so to work well means to work in a safe and healthy manner. So when you are training someone, for example, to perform in the, for example, woodworking activities, you have to incorporate what is the safe way in which they should work. For example, when you finish work, you always have to clean your hands. When you after work, you always have to put gloves, you know, something that the way of working should be always a safe and health working. Universities also may require some safety and health training because in the universities, you train, for example, architects or civil engineers or safety or for example, managers of companies. And these people are people that will make decisions on occupational safety and health. So they should have some information and some training on safety and health. This is the type of training of education that is required, and is in many countries they have included in the general education system. I would like just to bring to your attention, for example, one particular group that is quite vulnerable group. They are the young workers. Young workers experience much higher rates of non-fatal occupational injuries than adult workers. For example, in the European Union, according to the statistics, more than 40% higher among young workers aged from 18 to 24, the number of accidents. In the US, 2 times higher among young workers aged between 25 and 24 years old. So what I'm saying is that young workers, because they are young and because they have no experience or no training, frequently they suffer much more accidents than adult workers. So, for example, United States has created one course. I mean, the National Institute of Occupational Safety and Health has created a course that is called Talking Safety. Each one, NIOS create a general course on this token safety, and each state of the United States has developed on this basis its own course. So this is a course that is delivered in the high schools for those young workers, young people that would like to work the part-time or during the summertime. So they have to take this course. This course basically includes around 6 sessions of 45 minutes. And this material, I have uploaded this material in your in the platform, so you can have a look to this material. This material includes a book, a trainer's book, because this material, this course is not delivered by the National Institute for Occupational Safety and Health, but by the same teachers in the high school. They are given this a PowerPoint presentation, some case studies, some trainer's book, and they use these resources for the delivery of this training. So I have uploaded just to have a look, to allow you to have a look these materials that they are using there to train this particular category of workers that are at risk. So I was mentioned before that there is a group of workers, there is a group that receive this safety and health education, but then there is other group that may require specific training in occupational safety and health. One is those that are specialists on occupational safety and health. We will see later the different levels and specializations. Other group is the workers. Workers need to receive training. And in fact, in most of the safety and health regulations include the obligation of employers to provide this safety and health training of the workers. For example, in Italy, workers need to receive 8 hours of training if you have a low-risk company, 12 hours of training if your company is medium-risk company, and 16 hours of training if you have a high-risk company. The particularity of Italy is that this training is not only received by workers, but also by managers and supervisors. Needs to receive at least this training of 8, 12, or 16 hours of training. For example, in our training center here in Turin, everyone has received a training of at least 8 hours. And basically, we have drafted this training. We have delivered this training for all of our staff, including our director, of course, on the type of risks and hazards that are associated to this type of work that we have here. For example, we have included what are the rights and duties, what are the risk assessment, what are the main risks associated with fire, electricity, economic risk, transport, commuting by transport to home, etc., etc. And also there is a specific training that needs to be provided for inspectors. If inspectors have to inspect safety and health, they need training. So it means that in each country, we should try to develop the capacity to deliver all this training, because we have to train a number, millions of people. For example, regarding the specific training of safety and health specialists, we have safety and health technicians. In some countries, this safety and health technician is someone that after the high school, after 18 years old, they take 2 or 3 years of a specialization on safety and health. Safety engineers, there are engineers with 1 master's on safety. Occupational doctors or occupational nurses, it changed from one country to another. For example, in Spain, occupational doctor may require 6 years to become a doctor plus 3 to become occupational doctor. That is too long, in my opinion. to produce so many occupational doctors as it is required in one country. But different countries may have different specializations. There are also in some countries occupational hygienists, ergonomists, or occupational psychologists. What are the training that workers need to receive? I mean, all the workers in general should receive a general safety induction. They need to know about emergency and evacuation procedures. If they are operating machine and tools, they need specific training, as well as if they have maybe have some ergonomic issues if they are working in manufacturing or in agriculture or in construction, or chemical awareness in the case of there are serious or dangerous chemicals around. Workers' representatives, in addition of these other of the training of the general workers, they may need some more specific and additional training on how it works a safety and health committee, or how to perform duties as a safety and health delegate. So, for example, here in Italy, if you want to become a safety and health delegate or be part of a safety and health committee, in addition to the training to become a safety and health training as a worker, you need to have an additional 15 hours of training to become a worker representative on occupational safety and health. Additionally, there are other type of trainings that workers may require if they have some specific duties. For example, you are a crane operator or a forklift operator. You need some specific trainings on the safety measures to operate a forklift or a crane. Or if you are a steward, you are a first aid, you require first aid training of fire extinguisher. If you are operating in a confined space, or you have to operate through manual handling. So there are several categories of workers that may require specific training. Let me bring you one case, particular case, because it is something that we are recently doing. I mean, we have been asked, our center, to provide a training modules for all workers of no high-risk sectors in Kosovo. The high-risk sectors in Kosovo are considered construction, manufacturing, transportation, agriculture, mining, and forestry. The rest of the all workers will be required to take a 5 hours training. We are now working in the development of 5 modules online that are accessible by computer or smartphone on the following topics that all the workers in Kosovo needs to take. And they have to take a final test, and they will generate a digital certificate. This is the type of this certificate is, let's say, a proof that you have taken this course and you have passed the final test. This will be required by law. Of course, other workers from high-risk sectors, they have a more complex and long training. Other example is, for example, in Singapore, they have to train workers in the construction sectors because they have a lot of accidents there related with poor training on occupational safety and health. So they required at the beginning that they need to train every year 100,000 workers in a 4-hour course on occupational safety and health. Initially, this training was provided by a training center on occupational safety and health. It's a center linked with the Ministry of Labor, and they managed to train all these workers. But these workers frequently they change locations or even country, or they change duties. So they may need periodically to train new workers on occupational safety and health. And in fact, one of the things that they do is to link this training on occupational safety and health to the obtention to the work permit. So no one that has not this safety and health training before joining Singapore on the construction sector will be allowed to come into Singapore. So they organized training courses in different countries that normally provide workers to in the construction sector in Singapore. And they organized training in the countries of origin, for example, in Thailand or in Indonesia or in Bangladesh. They were organizing this training on safety and health in construction so that workers, when they joined Singapore, they were trained on safety and health in construction. This is another experience. I also wanted to bring to your attention on how to plan the capacity of our country in terms of safety and health training. For example, you need to define what are the target groups. I mean, what are our target groups? We need to train safety and health specialists. We want to train workers. We want to train occupational doctors. Of course, we will need to train all these people, but well, you have to start with one and another or another when you have to make these decisions. For example, one important thing to decide is how many need to be trained in our country. And this is an important thing because sometimes you have a new regulation in which you decided that, for example, companies of more than 250 workers need to have an occupational doctor. So this was a decision made in one country, for example, this an example, and then realized that when enterprises were looking for occupational doctors, they were not enough occupational doctors in the country. So at the end, it was a big problem because you were asking the companies to have occupational doctors, and the capacity of the country or the number of occupational doctors were not enough to cover even 20% of the companies that were with this duty. What happened? It happened several things. First is that companies try to hire people from other countries that they have occupational doctors. Other thing that happened is that it stimulated the occupational medicine in the universities. Before, there were not many courses, but after this law, stimulated. But at the end, the Ministry of Labor, that was the one that issued this obligation, create what is called a transitional measure associated with this law, telling that in a period of 5 or 10 years, you can use as a doctor, not those that are occupational doctors, but doctors that at least have some experience in the enterprises, in the companies. So they were given, these medical doctors, they were given 5-year times to take the training and to pass an examination to be recognized as an occupational safety and health specialist. So when you have to train the people, you also have to decide what are the required competence of this category, of this group, how much will be the duration of the training, who will be the training provider. Sometimes governments, they wanted to deliver the training themselves, but frequently they don't have the size or the capacity to produce as many trainings as it is required at the national level. So it is this is the reason for which in most of the countries, the public authorities, labor authorities, create an accreditation system. It means that you accreditate training institutions with some conditions to deliver this training on occupational safety and health. For example, you need to have safety and health specialists, you need to have to follow this curricula of contents, or sometimes you can create conditions at the end of the services. I mean, when you train people, you train the people, but the state, I mean, the competent authorities will oblige all the people, all the trainees to pass an examination to become safety and health specialists. Or even, like in other countries, the labor inspectorate, in addition to inspect companies, also inspect training institutions to check that they are doing a good job. So another thing is that is important is how is the time required to train enough numbers of people to satisfy the regulations, and what are the transitional measures. So here you have, for example, an example of Thailand. In Thailand, there was created one law that was required enterprises with more than 50 workers to have safety officers at professional level. Initially, this training was delivered by the National Institute for Improvement of Working Conditions and Environment. However, the capacity of this National Institute is to train no more than 1,000 safety officers a year. So the need of Thailand was huge. I mean, they will need more than 100,000 safety officers. What they did, they create the conditions to accredit other institutions to provide this training in occupational safety and health. The National Institute for the Improvement of Working Conditions and Environment developed the curricula, developed the materials, etc., etc. But then they authorized more than 100 training institutions to deliver this training to become safety officers. So in 97, 98, these institutions were able to deliver training on safety and health for 100,000 safety officers that were enough or good enough for the needs of the country. So these are just bringing some examples on what are the challenges that you may have in planning the training or the information, and what different countries are doing. But I would like to bring to your attention is how important is to have trained resources in the companies as safety and health specialists on occupational safety and health. This make the difference. What happens most of the times is that the competent authority on safety and health is linked to the labor inspectorate. And frequently, the labor inspectorates are, most of the times, quite concentrated in their duties. And frequently, they don't have enough numbers even to perform their own duties. And most of the times, if the more you develop the private system and the more you develop the capacity of the enterprises to take care of their own safety and health problems, the better it is for the labor inspectorate. Because when you go there, you will find someone with whom you can talk on occupational safety and health, and they understand you. Because most of the times, if you don't have staff in the companies on safety and health, it's not easy to progress with the companies on safety and health. So this is what I wanted to bring to your attention, and I would like to ask you if you have any question or any comment on all these issues. Any question? Just for your information, there is one part in the platform in which I am uploading materials that I think that will be quite relevant for your, for following all these issues. We have already uploaded in the platform issues related with the sessions that we already had on labor inspection, on regulations, but also we are uploading other materials. Let me check how to get it. So here we are on the contents of the module 2. There are these suggested additional readings. For example, here I have included some documents on information training and technical assistance, as these presentations that are used for education in United States on how to mainstream in safety and health in university education. Here you have a set of documents and books on inspection, national systems, consultation and coordination, safety and health regulations. And here I have also included the most relevant documents that the ILO has elaborated on recording, reporting, and notification of occupational accidents and diseases. That is the session that we will deliver next Monday. So it's just to let you know that in addition of the modules that you have, you can also find quite relevant information on suggested additional readings, in this case regarding the module 2. Okay. Any comment or any question? Okay. I will not take more of your time. Thank you very much for your attention and for your participation. Do not hesitate to write me if you may need additional information on any particular issue. I mean, because here in the ILO, we have access to a lot of information, not only of the same ILO, but also from national experience. So if you may want to know more about some specific issue, don't hesitate to contact me. I mean, we are paid for that. So please, I mean, if you need, okay, I will need some information on this particular thing or on this type of regulation or whatever. So don't hesitate to do it, okay? Okay. Then thank you very much, and see you next Monday on the sessions on recording and reporting and notification of occupational accidents and diseases. Okay? Have a good day. Bye-bye.
Bye-bye.
Thank you. Have a good day.
Thank you.
Thank you. Bye-bye.
Thank you.